Picture yourself visiting family around Christmas. It's freezing cold outside. There's a wind that's so crisp that it gives you the chills. There's snow on the ground and lights hanging on all the houses nearby, giving you a whole bunch of senses of Christmas joy. Now picture that you are in a hospital. You and your family are all gathered around one single hospital bed because a loved one has been recently diagnosed with cancer and only has a few weeks to live. Doctors are coming in and out of the room, taking vitals and servicing medicine to the patient, your family member, telling you and your family that they're doing everything they can to make the loved one comfortable. But they can't move, they can't talk, and they sure can't do anything that they love anymore, let alone tell you whether or not they're actually comfortable. Racking up the medical bills for all the medications being serviced and equipment being used to keep your loved one there just a little bit longer. And it may be the last thing on your mind in this said scenario, but your loved one has sure thought about it whilst they lay there on the bed. Doctor-assisted suicide is a very controversial topic, and for many reasons. Many people are frightened just by the term because of the word suicide, and it can become off as very harsh. Many doctors prefer to refer to doctor-assisted suicide as death with dignity or medical aid in dying. Death with dignity is for patients who have been diagnosed with a terminally ill disease and have been given a life expectancy of how long they have left to live, and it's usually a very short amount of time. Many people are on the fence about medical aid in dying because they fear someone may be depressed will try and use death with dignity as a solution. But this is not a solution for people with depression. This is a solution for people who are sick, and it's almost like their lives are already over. Doctors want to help their patients. In fact, they've taken a vow to help people in need. Picture having an emotional bond with one of your patients who lives basically in a hospital bed, awaiting death day by day. There's nothing left that the doctors can do but feed the said patient medication, hoping that they feel no pain. Death by dignity should be legalized in all states for people who have been diagnosed terminally ill. Someone who is terminally ill should not have to think about the medical bills they will be leaving behind to their loved ones from being in the hospital or on hospice and certain medications, or have to worry about putting on a face that shows no pain or no fear around their loved ones because they don't want them to fear what's to come for them. Death by dignity is a painless procedure where doctors would administer a lethal dose of medication, and it's similar to falling asleep. Medical aid in dying should not be available to everyone, and a doctor should have to list that as an option before a patient can even choose it. This is for people who are above the age of 18, and if you are not, you would need parental consent, that have been diagnosed with a terminally ill disease, because this is not a solution to depression or hardships in life. Death by dignity could and should be legalized to stop the pain and suffering in terminally ill patients, and so that loved ones don't have to watch said ill person suffer. In December of 2019, my 80-year-old grandpa was diagnosed with cancer. By January 9th of 2020, he passed away in his sleep at 2 a.m. When first diagnosed, my grandpa was already suffering and had been sick for a while, but the doctors were unsure of what it was and hadn't diagnosed him yet. When he was finally diagnosed with cancer, they gave him about 6 weeks to live, and he only lived for about 3. He was quickly put on hospice, where he was unable to walk or talk, and some days he wasn't even coherent to what you would say to him. Each day he grew worse and worse and was clearly in a lot of pain. So much pain I never even went to visit him while he was on hospice, because the thought of seeing him like that, I was afraid it would overwhelm me, and I wanted to keep his cheery, snarky personality in my memory. I can remember when he would be sitting in his favorite chair in the corner of the room, always eating sour lemon candies, and he always had golf on the TV with my grandma because that was like their favorite thing to watch. And he would grab this cat laser he used for playing with the cats, and a lot of the time, the cats are always really oblivious to where the laser is coming from, and they chase it up and down the halls. And I was so young, I was almost just as fooled as the cats, and I would be running around trying to catch it, and eventually I would look at him and laugh at him and say, I know you have it, but he would still continue to run it up and down the house, and I would still continue to chase it. I don't know if he would have chosen death with dignity if it was an option, but I wish he could have at least had the option not to suffer, because I know those last 3 weeks were not how he would have chosen to go out. Death with dignity has been judged so harshly to some, maybe because they've never had to see someone they love so much suffer so much and been given such a short time left to live. Medical aid in dying should be legalized so that people can focus on their goodbyes and eternal peace that is to come, and not the lingering worry that their loved one is suffering.